A looming crisis: heart health in the UK. The state of heart health in the United Kingdom is becoming increasingly alarming, with more and more people being affected by cardiovascular diseases. The UK is facing a heart health crisis. This crisis is not just a statistic. It affects real people, families, and communities across the nation. The numbers are stark, and the trends are worrying. Heart disease rates have been climbing steadily, and the data shows no signs of this trend slowing down. Since 2020, we've seen a concerning rise in heart disease. This is deeply troubling. The pandemic has exacerbated existing health issues, making it even more critical to address heart health now. It's time we take notice and understand the factors at play. We need to look at the root causes and the various elements contributing to this crisis. Our collective heart health is declining. This decline is not limited to any one age group. It affects young and old alike. Cardiovascular diseases are still a leading cause of death in the UK. Despite advances in medical science, heart disease remains a significant threat. This is not something we can ignore. The impact of heart disease is far-reaching, affecting not just individuals but also the healthcare system and the economy. We need to understand the reasons behind this trend. By identifying the underlying causes, we can develop more effective strategies to combat heart disease. Many factors contribute to this crisis. Obesity rates are rising. Poor diet and lack of exercise are significant contributors to the increasing rates of heart disease. Diabetes is becoming more prevalent. This condition is closely linked to heart health, and its rise is a worrying trend. The COVID-19 pandemic has also had an impact. The virus has put additional strain on the healthcare system and has had long-term effects on people's health. We need to address these issues head-on. Community initiatives and government policies must focus on improving heart health. We can improve our heart health. Simple lifestyle changes, such as regular exercise and a balanced diet, can make a significant difference. By understanding the risks and making lifestyle changes, we can make a difference. Education and awareness are key to preventing heart disease. Let's delve deeper into this critical issue. Together, we can work towards a healthier future for everyone in the UK. The grim statistics. A look at the numbers. These figures are more than just data points. They represent real lives affected by serious health issues. The British Heart Foundation paints a sobering picture. Their comprehensive research delves deep into the state of cardiovascular health in the UK. Their research reveals some alarming trends. The data indicates a steady increase in the prevalence of heart-related conditions. Cardiovascular diseases remain a leading cause of death in the UK. Despite advances in medical science, these diseases continue to claim numerous lives each year. In 2023 alone, these diseases claimed thousands of lives. Each number in these statistics represents a family affected, a community in mourning. Heart failure rates are also on the rise. This condition, often a result of untreated or poorly managed cardiovascular issues, is becoming increasingly common. This condition affects a significant portion of the population. From young adults to the elderly, heart failure does not discriminate. It puts a strain on the NHS and impacts the quality of life for many. The healthcare system is stretched thin, trying to manage the growing number of patients. We need to understand why more people are developing heart failure. Lifestyle choices, genetic factors, and environmental influences all play a role. Diabetes, often linked to heart problems, is another concern. The correlation between diabetes and cardiovascular diseases is well documented. The number of people diagnosed with diabetes has increased significantly in recent years. This rise is alarming and calls for immediate attention. This trend further exacerbates the heart health crisis. Poor dietary habits and sedentary lifestyles contribute to both diabetes and heart disease. These statistics are a wake-up call. They highlight the urgent need for public health interventions and personal lifestyle changes. We must act now to reverse these trends. Community initiatives, policy changes, and increased funding for research are essential. Prevention and early intervention are crucial in tackling this growing problem. By promoting healthier lifestyles and ensuring early diagnosis, we can make a significant impact. The weight of the matter: obesity and heart disease. Obesity is not just about carrying extra pounds. It's a serious health condition that can lead to numerous complications, particularly heart disease. Obesity is a major risk factor for heart disease. When a person is obese, their heart has to work harder to pump blood, which can lead to various cardiovascular issues over time. As obesity rates climb, so do the rates of heart problems. The correlation between the two is undeniable, and it's a growing concern for healthcare professionals worldwide. Excess weight puts a strain on the heart. This strain can make everyday activities like climbing stairs or exercising much more difficult and exhausting. It can lead to high blood pressure, high cholesterol, and other issues. These conditions are often precursors to more severe heart problems, such as heart attacks or strokes. Carrying extra weight, especially around the midsection, is particularly harmful. This type of fat, known as visceral fat, is more dangerous than fat stored in other areas of the body. This visceral fat is linked to inflammation and insulin resistance. These conditions can disrupt the body's normal functions and lead to chronic diseases. Both of these increase the risk of heart disease. Inflammation can damage the arteries, while insulin resistance can lead to type 2 diabetes, both of which are significant risk factors for heart disease. We need to find effective ways to combat obesity. This involves a combination of community efforts, healthcare interventions, and individual lifestyle changes. This includes promoting healthy diets and regular physical activity. Eating a balanced diet rich in fruits and vegetables and engaging in regular exercise can help manage weight and improve heart health. Addressing the root causes of obesity is vital for improving heart health. By understanding and tackling the underlying factors, we can make significant strides in reducing the prevalence of heart disease and improving overall well-being. The sugar connection, diabetes and cardiovascular health. Diabetes is closely linked to heart disease. High blood sugar levels damage blood vessels. This damage increases the risk of heart attacks, strokes, and other cardiovascular problems. Type 2 diabetes, the most common form, is often linked to lifestyle factors. These factors include poor diet and lack of exercise. We need to raise awareness about the connection between diabetes and heart health. Managing diabetes is crucial for protecting heart health. This includes medication, regular blood sugar monitoring, and lifestyle changes. A holistic approach is needed to address this growing concern. Section 5. A perfect storm: COVID-19, the NHS, and health inequalities. The COVID-19 pandemic has exacerbated the heart health crisis. The virus itself can damage the heart. Lockdowns and disruptions to healthcare also played a role. Many people delayed seeking medical attention for heart problems. The NHS, already under strain, has faced immense pressure. This has led to longer wait times for treatment and diagnosis. Addressing the backlog in cardiovascular care is a priority. Health inequalities also contribute to the problem. People from deprived backgrounds often face greater risks. They may have limited access to health care and healthy food options. Tackling these inequalities is crucial. Section 6. A beacon of hope. The British Heart Foundation's new strategy. The British Heart Foundation, or BHF, is at the forefront of the fight against heart disease. They are launching a new strategy to tackle this growing crisis. This strategy focuses on research, prevention, and improving care. The BHF recognizes the need for innovation. They are investing heavily in research to find new treatments and cures. This includes exploring cutting-edge technologies and therapies. Collaboration is key to their approach. The BHF is working with partners across the healthcare sector. They aim to improve early detection and provide better support for patients. Section 7. Embracing technology, AI, data science, and the future of heart health. The BHF's new strategy embraces the power of technology. Artificial intelligence, or AI, and data science are playing an increasingly important role. These technologies can analyze large data sets to identify trends and risk factors. AI can help develop personalized treatments. It can also assist in early diagnosis by analyzing medical images and patient data. Data science can inform public health initiatives and target interventions more effectively. Genomics is another area of focus. Understanding the genetic factors behind heart disease can lead to more targeted therapies. It can also help identify individuals at higher risk. Section 8. Towards a healthier future. The BHF's 2035 goals. The BHF has set ambitious goals for 2035. They aim to reduce premature deaths from heart disease by 25%. They also want to see a significant improvement in survival rates for heart failure. Achieving these goals will require a concerted effort. It involves continued investment in research, prevention programs, and better access to care. Public awareness campaigns are also crucial. Healthcare experts believe these goals are achievable. By working together, we can create a future where fewer people suffer from heart disease. Section 9. Small steps, big impact. Taking charge of your heart health. You can take steps today to improve your heart health. Start by making small changes to your lifestyle. Eat a balanced diet rich in fruits, vegetables, and whole grains. Engage in regular physical activity. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. Get regular checkups. Knowing your blood pressure, cholesterol levels, and blood sugar levels is important. Early detection and treatment can make a significant difference. Remember, small changes can have a big impact on your heart health. Take charge of your health today.